Good morning friends. Today we are going to discuss about major depressive disorder DSM-5 criteria, also known as MDD. So, discussing about major depressive disorder is important because nowadays depression is rising among the community, especially among the young people. After a prolonged exposure to pandemic situation since 2019, 20, 21, this populations of the children, adolescents and the young generation, those who are captivated for the long time in their home, college, school, institute, all are almost closed. Only online system is going on, whether it is education or work from home. And this is why, since there is a precipitating factor, there is sudden break in the modern lifestyle. And this application of sudden break due to pandemic situation, depression is rising day by day. So today it is very important to bring the awareness among this population to know about depression, so that by the virtue of knowledge they can take their own care and they can understand it earlier than it is become more serious. So let's discuss what is MDD or major depressive disorder as per the DSM-5 criteria. So according to the DSM-5 criteria, there are a few symptoms. Out of that, 2 symptoms are the deciding factors, and these are prolonged sad mood or loss of interest or loss of pleasure. The person is not able to enjoy the pleasure, and this situation is known as anhedonia. So symptoms are present nearly every day, most of the day, for at least 2 weeks. So 2 weeks is the criteria for diagnosis of major depressive disorder. Symptoms are distinct, more severe than a normative response to significant loss. Plus, along with these 2 criteria, 4 more criteria out of this following symptoms is important. Number 1, sleeping too much or too little, psychomotor retardation or agitation, poor appetite and weight loss or increased appetite and weight gain, loss of energy, feeling of worthlessness or excessive guilt all the time, feeling of too much hopelessness, worthlessness, excessive guilt remain prominent and affecting almost all functional domain, whether it is personal, social, occupational, family, or anywhere. All time there is excessive guilt feeling, hopelessness, worthlessness, helplessness and feeling of all this combination. Next is difficulty in concentrating, putting attention on the work the person is doing, and there is difficulty in concentrating any thought and difficulty in making decisions. A recurrent thought of death or deliberated self-harm or suicide. So these are a few symptoms which indicate you need the help of psychiatrist or the doctor nearby the place you are residing. So don't hesitate. If you find these symptoms are emerging among your dependents, children, adolescents or adults or anyone, if you find that someone is having these symptoms, this is the alarming sign that might be he is suffering from depression. Is not getting evident, and it is getting evident by his change in the behavior, and this behavior affecting almost all domain for not less than 2 weeks. So this is the major depressive disorder criteria as per the DSM-5 diagnostic criteria. Thank you friends. We will again meet with a different topic so that we can elevate the mental health of the community, and so that we can help them to bring the mental well-being and physical health. Thank you. Meet you again.